Could your liver be silently sending you warning signals without you even realizing it? You'd be surprised at how this vital organ can suffer in silence. Right now, over 25% of adults worldwide, including in the United States, are affected by some form of liver disease, and this number is increasing every year. Yet, many people still believe that alcohol is the only culprit. But are you at risk? The truth is far more alarming. What you eat every day, the medications you take, and even exposure to environmental toxins could be slowly damaging your liver without you knowing. And the scariest part, the early warning signs are often strange, subtle, and incredibly easy to overlook. In today's video, we're going to explore 12 weird signs that could mean your liver is in trouble, signs that are often ignored or mistaken for less serious issues. Why does this matter? Because your liver is one of the few organs that can regenerate itself, but only if you catch the damage early and take the right steps. Stay with us until the end to discover if you could be experiencing one of these symptoms without realizing it. Your health could depend on it. And rest assured, all the information we're sharing today is supported by health professionals and backed by medical research. So let's dive in and see if your body is sending you silent signals that shouldn't be ignored. Causes of liver damage. Before we jump into the signs, let's talk about what could be causing liver damage in the first place. And it's not just about alcohol. While excessive alcohol consumption is often the most well-known cause of liver damage, it's far from the only one. Many people don't realize that daily habits, even those that seem harmless, can gradually wear down this vital organ. One of the biggest offenders is sugary and processed foods. High sugar intake, especially fructose, can overwhelm the liver, leading to a buildup of fat that impairs its ability to function properly. This is why diets high in sugary snacks, sodas, and processed junk food can be just as damaging as heavy drinking. Next, we have vegetable oils like corn, soybean, and canola. These oils are rich in omega-6 fatty acids, which can trigger inflammation in the liver when consumed in excess. Chronic inflammation over time can lead to serious liver conditions. Surprisingly, overuse of painkillers is another common cause. Medications like acetaminophen, Tylenol, and ibuprofen, when taken frequently or in high doses, can strain the liver and cause damage. Always be mindful of how often you're relying on these medications. Viral infections, particularly hepatitis, can also take a toll on the liver. Hepatitis B and C are especially notorious for causing long-term damage if left untreated. Lastly, environmental toxins from sources like pesticides, plastics, and pollution can build up in your body and harm liver function. Our modern world exposes us to many chemicals, and over time, these toxins can place an extra burden on your liver. But don't worry, in just a few minutes, we'll share simple, natural tips to help your liver heal and reverse the damage. So stay tuned for easy steps you can start today. 12 weird signs of liver damage. 1. Pale or clay-colored stools. Let's start with something you might notice in the bathroom. Pale or clay-colored stools. This may seem unusual, but it's one of the earliest signs that something's not right with your liver. When your liver is healthy, it produces bile, a substance that helps digest fats and gives your stool its typical brown color. However, if your liver isn't functioning properly, whether due to inflammation, fatty liver disease, or bile duct obstruction, this bile production can be reduced or blocked. As a result, your stool can appear pale, clay-colored, or even chalky. Medical studies confirm this link between pale stools and liver dysfunction. According to research published in the Journal of Hepatology, reduced bile flow, known as cholestasis, can be a key indicator of liver disease. This condition may arise from liver inflammation or blockage of the bile ducts, which prevents bile from reaching your intestines and ultimately leads to the loss of the normal stool color. If you notice your stool has become consistently lighter in color, it's important not to ignore it. This could be an early sign of liver damage or conditions like hepatitis, cirrhosis, or gallstones. Seeking medical advice early could prevent the condition from worsening and give your liver a better chance of healing. 2. Poor night vision. Struggling to see in the dark lately? Poor night vision could be more than just an inconvenience. It might actually be a sign that your liver isn't functioning properly. Your liver plays a vital role in helping your body absorb fat-soluble vitamins, including vitamin A, which is essential for healthy vision, especially in low-light conditions. When your liver is damaged or unable to produce enough bile, it struggles to absorb vitamin A efficiently. This deficiency can affect the retina, specifically the rod cells that allow your eyes to adjust to dim light, leading to what's called night blindness or difficulty seeing in dark environments. Medical studies have demonstrated this link between liver health and vision. According to research in the British Journal of Ophthalmology, liver diseases like cirrhosis and cholestasis can lead to significant reductions in vitamin A levels, directly impacting vision. In severe cases, long-term vitamin A deficiency due to liver dysfunction can result in permanent damage to the eyes. If you've noticed it's becoming harder to see at night, or you're having difficulty adjusting your vision in low-light settings, it could be more than just aging or tired eyes. It may be your liver signaling that it needs attention. Consulting with a healthcare professional can help identify the root cause and prevent further damage. If you're enjoying the video so far, hit the like button to help us reach more people. And make sure to subscribe and turn on the notification bell so you don't miss any of our future content. 3. Swollen right foot. Swelling in your right foot could be more than just a sign of standing too long. It might actually be an early indicator of liver damage. When the liver isn't functioning properly, it can lead to a condition called peripheral edema, where fluid builds up in the tissues of the body. The liver plays a critical role in regulating proteins like albumin, which helps maintain fluid balance in the bloodstream. When liver function declines, albumin levels drop, and the body struggles to keep fluids where they belong, causing them to accumulate in the lower extremities, often starting with the feet, particularly the right foot. Medical research supports this link between liver damage and swelling. Studies published in the Journal of Clinical Gastroenterology highlight how liver diseases such as cirrhosis can impair blood flow and lead to increased pressure in the veins, pushing fluids into surrounding tissues, especially in the legs and feet. Swelling may be more pronounced on the right side due to the way blood circulates through the liver and other organs. If you've noticed persistent swelling in your feet, particularly in the right one, it could be a sign that your liver is struggling to do its job. Seeking medical advice is essential to determine whether liver disease or another condition is responsible and to address the issue before it worsens. 4. White or yellow bumps around your eyes. Those little bumps around your eyes might not just be a cosmetic issue. They could actually be cholesterol deposits, signaling that your liver isn't breaking down cholesterol properly. These small white or yellowish bumps, known as xanthelasma, are typically found around the eyelids. They form when cholesterol builds up under the skin, which can happen when your liver is not efficiently processing fats and cholesterol. Normally, the liver helps regulate cholesterol levels in the blood, breaking down excess amounts and removing them from the body. However, when the liver is damaged or overwhelmed, cholesterol can accumulate in different parts of the body, including around the eyes. Research in the Journal of Lipid Research indicates that people with liver conditions, especially those with fatty liver disease or bile duct problems, are more likely to develop xanthelasma. This is because the liver's impaired function causes cholesterol to remain in the bloodstream longer, leading to deposits in areas like the skin around the eyes. If you notice these white or yellow bumps, it's not just about appearance. It could be your body's way of telling you that your liver is under stress. Consulting with a doctor can help you understand whether these deposits are linked to liver health and how to address the underlying issue. 5. Pressure on the right side of your ribs. Feeling pressure on the right side of your ribs, especially after eating, that could be thick, sludgy bile putting pressure on your liver and gallbladder. The liver and gallbladder are located on the right side of your abdomen, just beneath the rib cage. When your liver is damaged, bile, a digestive fluid produced by the liver, can become thick and sluggish. This sludgy bile can clog the small ducts that connect your liver to your gallbladder, causing a buildup of pressure. This often results in a feeling of tightness or discomfort in the right side of the abdomen, particularly after meals when bile is needed for digestion. Studies from the American Gastroenterological Association show that right-sided abdominal pain or discomfort is a common symptom in individuals with liver or gallbladder disorders, such as cholestasis or gallstones. The pressure from blocked bile ducts can even affect nearby nerves, like the phrenic nerve, which may cause discomfort that radiates to the right shoulder. If you frequently experience this sensation of pressure or tightness, especially after eating, it could be a sign that your liver is struggling to process bile properly. Ignoring this symptom could lead to more severe complications, so it's crucial to consult with a healthcare professional to get to the root of the problem. 6. Purple or red bumps on your skin. If you're noticing strange purple or red bumps on your skin, it could be a sign of poor blood clotting caused by liver damage. Your liver plays a vital role in producing proteins that are essential for blood clotting, such as fibrinogen. When your liver is damaged, its ability to produce these proteins decreases, which can result in abnormal bleeding or bruising. This can manifest as small purple or red bumps, often referred to as petechiae, which appear on the skin in areas like the arms, legs, or torso. These bumps occur because the blood vessels under the skin rupture, leading to small spots of blood leakage. According to studies published in the Journal of Hepatology, liver conditions such as cirrhosis and hepatitis can impair the liver's ability to produce clotting factors, leading to increased bruising and unusual skin marks. In severe cases, this may also indicate thrombocytopenia, a condition where there are low levels of platelets in the blood, further reducing the blood's ability to clot properly. If you're seeing these purple or red spots on your skin without any apparent cause, it's important to take them seriously. They could be an early warning sign of liver damage or even a more advanced stage of liver disease. Consulting a doctor can help determine if liver health is at the root of the issue and how to address it. 7. Cracked heels. Cracked heels might be more than just a cosmetic issue. A lack of vitamin B3 caused by liver damage could be the reason. The liver is responsible for many crucial functions, including storing and distributing essential nutrients like vitamin B3, also known as niacin. This vitamin plays a key role in maintaining healthy, moisturized skin. When the liver is damaged, it uses up its reserves of vitamin B3 to help repair itself, leaving less of the nutrient available for other parts of the body, such as the skin. The result? Dry, cracked heels and feet that may not heal with regular moisturizers or creams. Research published in the Journal of Clinical Nutrition shows a direct link between liver dysfunction and vitamin B3 deficiency. When the liver struggles to store or release enough B3, the skin suffers, leading to issues like cracking, particularly in areas under constant pressure, such as the heels. This can be one of the more subtle yet telling signs of liver damage. If you've been experiencing persistent cracked heels that don't improve with basic care, it might be worth considering the health of your liver. Taking action to address liver health could help resolve the issue at its source, rather than just treating the surface symptom. 8. White or clubbed nails. If your nails are turning white or getting rounded, it could be a serious sign of liver trouble. This happens when your liver isn't getting enough oxygen to your nails. Your nails can reveal a lot about your internal health, especially when it comes to your liver. White nails, or clubbed nails where the nails become rounder and the fingertips appear swollen, are often linked to liver damage. When the liver is struggling, it can reduce the amount of oxygen-rich blood that reaches your extremities, including your nails. This lack of oxygen can cause your nails to lose their natural pink color and take on a pale white way. Medical studies published in the British Journal of Dermatology have shown that individuals with advanced liver disease, such as cirrhosis, often present with Terry's nails, a condition where most of the nail turns white, leaving only a small pink band near the tip. This is a clear indicator of poor liver function and decreased blood flow. Similarly, clubbed nails have been associated with conditions that affect oxygen levels in the body, including chronic liver disease. If you notice your nails becoming white or clubbed, it's essential to consult a healthcare professional. These changes could point to a more serious underlying issue with your liver, and early intervention could prevent further complications. 9. Dark urine. Dark yellow or brown urine could mean your liver isn't filtering bilirubin properly, leading to a darker color. Your liver plays a crucial role in breaking down old red blood cells, which release a yellowish pigment called bilirubin. Normally, your liver filters bilirubin out of your bloodstream and processes it so that it can be excreted through bile or urine. However, when your liver is damaged or isn't functioning properly, bilirubin can build up in your body, causing your urine to turn a dark yellow, brown, or even a cola-like color. Medical studies have shown that dark urine is a common symptom in conditions such as hepatitis, cirrhosis, or bile duct obstruction, where bilirubin is not adequately processed. According to research published in the Journal of Hepatology, elevated bilirubin levels can indicate liver inflammation or scoring, both of which interfere with normal liver function. If you notice that your urine consistently appears dark despite staying well hydrated, it could be a red flag that your liver is struggling to filter toxins and break down bilirubin efficiently. It's essential to seek medical advice as soon as possible, as dark urine can be an early indicator of serious liver issues that require prompt attention. 10. Yellowed skin, jaundice. A yellowish tint to your skin or eyes, known as jaundice, is a big warning sign that your liver is in serious trouble. Jaundice occurs when there's an excessive buildup of bilirubin in the bloodstream. Normally, your liver processes bilirubin and removes it from your body. However, when the liver is damaged, whether due to hepatitis, cirrhosis, or even liver cancer, it can no longer filter bilirubin properly, causing it to accumulate and turn your skin and the whites of your eyes a yellowish way. According to studies published in the World Journal of Hepatology, jaundice is one of the most noticeable and serious signs of liver dysfunction. It indicates that your liver is overwhelmed and unable to perform one of its core functions, breaking down and eliminating bilirubin. This condition can also be accompanied by other symptoms, such as dark urine or pale stools, all of which point to liver distress. If you develop jaundice, it's crucial to seek medical help immediately. This yellowing of the skin is not just a cosmetic issue, it's a signal that your liver is struggling, and prompt diagnosis and treatment are necessary to prevent further damage. 11. Spider veins. Noticing small spider-like veins on your skin. This could be from high estrogen levels, which occur when your liver isn't filtering hormones properly. Spider veins are tiny, visible blood vessels that often appear on the face, legs, or chest. They resemble a spider web and are usually red or blue in color. While these veins may seem harmless, they can indicate an underlying issue with liver function. One of the liver's key roles is to filter and regulate hormones in the body, including estrogen. When the liver is damaged or not functioning correctly, it may struggle to filter excess estrogen from the blood, causing the hormone to build up. Elevated estrogen levels can weaken blood vessel walls, leading to the development of spider veins. Medical studies, such as those published in the Journal of Clinical Endocrinology and Metabolism, have found that individuals with liver disease, particularly cirrhosis, often have higher estrogen levels, which contributes to the appearance of spider veins. This is because the liver's ability to process hormones and filter blood is compromised. If you're noticing these small veins becoming more prominent, it could be a sign that your liver isn't filtering hormones properly. While spider veins themselves aren't life-threatening, they may be an early indication of liver stress that requires medical attention. 12. Itchy skin. Lastly, persistent itchiness, especially on your hands and feet, could be a sign of bile acid buildup due to a struggling liver. While occasional itching might not seem concerning, persistent and unexplained itchiness, particularly on your hands and feet, could be a sign that your liver isn't functioning properly. When the liver is damaged, it may not effectively filter bile acids from the bloodstream. These acids can then accumulate under the skin, leading to a constant itchy sensation. This condition, known as cholestatic pruritus, is closely linked to liver diseases such as cholestasis, cirrhosis, or bile duct obstruction. Medical research, including studies published in the New England Journal of Medicine, highlights how the buildup of bile acids in the skin can trigger itching that is often difficult to relieve with regular topical treatments. In some cases, the itching may worsen at night or when the skin is warm, making it even more uncomfortable. If you've been dealing with persistent itching, especially without a clear cause like dry skin or allergies, it could be an early sign of liver trouble. Consulting a doctor is essential, as addressing the underlying liver issue can help alleviate the discomfort and prevent further damage. How to reverse liver disease. So, what can you do if you've spotted some of these signs? The good news is, your liver is one of the only organs that can completely heal and regenerate itself if you take the right steps. The liver has an incredible ability to regenerate, but it needs your support to do so. Here's how you can help reverse liver damage and restore your liver to better health. Clean up your diet. Start by cutting out sugary and processed foods. These foods are loaded with chemicals, artificial ingredients, and excess sugars that overwhelm your liver. Reducing or eliminating these will give your liver a much-needed break from constantly working to filter out harmful substances. Focus on whole, unprocessed foods that are easier for your liver to manage. Eat sulfur-rich foods. Sulfur-rich foods such as leafy greens, garlic, onions, and broccoli are essential for liver health. Sulfur helps your liver detoxify and promotes the production of glutathione, a powerful antioxidant that aids in the liver's natural healing process. These foods boost the liver's ability to cleanse itself and process fats. Drink coffee with turmeric. A great remedy for liver health is drinking organic coffee with half a teaspoon of turmeric each day. Both coffee and turmeric are packed with phytonutrients that help reduce liver inflammation, decrease scar tissue, and promote liver regeneration. According to studies, coffee has been linked to lowering the risk of liver disease, while turmeric's active compound, curcumin, supports liver repair. Stay hydrated. Drinking plenty of water, at least 1 liter a day, is key to helping your liver produce bile and flush out toxins. Hydration helps thin the bile, making it easier for your liver to remove waste from your body. Avoid inflammatory oils. Unhealthy oils like canola, corn, and soybean oil contribute to liver inflammation. Replace them with healthier anti-inflammatory fats, such as extra virgin olive oil and coconut oil, which have been shown to protect the liver and reduce damage. Intermittent fasting. Practicing intermittent fasting can give your liver the time it needs to heal. Fasting reduces inflammation, helps burn off excess fat stored in the liver, and triggers autophagy, a process where your body recycles damaged liver cells and replaces them with new, healthy ones. Consider supplements. Taking purifying bile salts or digestive enzymes containing ox bile can assist your liver in breaking down fats more efficiently and prevent the formation of gallstones. These supplements can help lighten the liver's workload, giving it more capacity to regenerate. By making these simple changes, you can support your liver in its natural healing process and help reverse liver damage before it becomes more severe. In conclusion, your liver works hard for you every single day, quietly filtering out toxins and keeping your body in balance. That's why it's so important to pay attention to the subtle signs it might be sending you. If you noticed any of the symptoms we discussed in this video, whether it's pale stools, itchy skin, or persistent swelling, make sure to talk to your doctor and get your liver checked. The earlier you catch liver issues, the better your chances of reversing the damage. Remember, liver disease can progress silently, with many people not realizing there's a problem until it's too late. But the good news is that your liver has the incredible ability to heal itself if you make the right changes to your diet, lifestyle, and overall health. So don't wait, take action now and give your liver the care it deserves. If this video helped you learn more about how to protect your liver, don't forget to give it a thumbs up and subscribe for more tips on staying healthy and happy. And before you go, click on one of the videos on the screen to stay informed and continue improving your health. Thanks for watching, and we'll see you in the next one.